today is session 2, and we'll be focusing on more general strategies for supporting a young person with early psychosis. A brief outline of what we'll be covering. Aisha will talk about a background on early psychosis. Then we'll cover, the various roles that families are in. We'll talk about some general strategies and then some focus on relationship-focused communication, where we'll talk about first really focusing and strengthening your relationship with your loved one, how to engage in curious questioning, this idea of validation and how to implement it, as well as discussing the writing reflex. And then we'll end with just a quick reminder of some of the STEP Learning Collaborative resources that are available to you. So now I will hand it over.
Hello, everyone. Welcome. So I guess before we get started, some of you have been probably here the first session. If not, welcome. But we do recognize that we have some new folks today, so we figured we'd do a very brief overview on psychosis to get some folks acclimated to the material. So if you want more information from our first session that speaks more about psychosis in detail, feel free to email us and we'll send you the slides. But let's talk about what is first episode psychosis. So what we know is that first episode psychosis simply refers to the first time someone experiences psychotic symptoms or a psychotic episode. So people typically experiencing a first episode may not really understand what's happening. The symptoms can be highly disturbing and unfamiliar, leaving the person confused and distressed, and family members or loved ones may be bewildered at what's kind of going on. And so what we do know is that symptoms may appear suddenly or gradually build over months to even years. And so something that we do know is that diagnostic uncertainty is expected part of early psychosis treatment. So there are many different causes of psychosis, and so you kind of take your time to figure it out. But a diagnosis does become clear over time. Again, we did go into detail about this in the first session, but I really just want to do some high-level points to remind folks, or even bring newer folks who are attending today up to speed of what we know about psychosis. And so people who do experience psychosis obviously have a range of symptoms, and so we have positive symptoms. So these are the most recognizable symptoms that are called positive symptoms. And so it's not positive as in good, but more so it's adding on or it's distorting someone's experience. So this usually involves hallucinations or delusions. And so for folks who have a different time differentiating between hallucinations and delusions, I'll give a little brief definition. And so hallucinations are things that people may hear or see. This could also be tasting or smelling things that are not present. When I think of delusions, it's kind of like a number of things that could be under that umbrella, but often includes believing things that aren't true or unrealistic or may even be impossible. Sometimes illusions can feel a little bit bizarre. So like this could be like, oh, like there's an alien who implanted something in my brain. And then there's some things that are not bizarre, but are unlikely or not true, where like my partner is cheating on me. So it can really range. But it is really important to recognize that this is an inherent part of psychosis in many folks, is that they'll have limited insight into these things. So there's a lack of awareness that they're experiencing that others may not believe are real and or impaired. So this can be really challenging for family members and providers alike. Some other symptoms that we have that are commonly seen as negative symptoms. So for positive, I think of addition, negative as in reducing or losing something. So this could be like a loss or reduction in normal perception, behaviors, and functioning. So decreased motivation, energy, enjoyment, less interested in your hobbies or in your home life or work life, whatever it may be. Then we have cognitive symptoms, so things kind of within your brain. So this could be you're more distracted, having a hard time planning or remembering. And then we have mood symptoms. So this could be mood, anxiety, depression, or even experience suicidal thoughts.
Great. Thank you so much for that important reminder of the background on psychosis. So now I'll be switching over and really talking about the role of families. And so one thing that we want to start with today is naming something that often goes unspoken. Psychosis doesn't just affect the young person, it affects the whole family. Research has consistently showed that for every one person experiencing psychosis, multiple people around them are impacted. This might be emotionally, practically, or financially. So many young people experiencing early psychosis, the vast majority, around 85%, are living at home and are relying heavily on family support. So this means that families aren't on the sidelines. You're often right in the middle of this, right? And it's important to recognize that family caregiving is usually an informal role. It's not something that most people have trained for. It's not something you're paid for. But as mentioned, it can be a significant emotional, economic, and practical contribution that you're making to your loved one. Perhaps at a time when you thought that the responsibilities of parenting may be changing a little bit as your young person kind of reaches young adulthood. So, in many ways, families end up doing the work that would otherwise be spread across multiple professionals. So, as folks in this audience might resonate with some of these, families often find themselves taking on roles like emotional support, helping with appointments, managing paperwork, navigating services, doing various things. And for many families, these roles come on quickly without much warning. Some families might be actively supporting someone who's engaged in treatment. Others might be trying to desperately help their loved one connect to care. Some might still feel unsure what's going on diagnostically. And, others, folks might be separated or navigating multiple hospitalizations, having an individual in residential care, or periods of time where, boundaries or separation are necessary. So there's no single right role. And we're not going to tell you what role you should be in. Today's session is really about offering you general strategies that can be helpful across many of these roles, especially when communication feels hard. So, one thing we want families to hear very clearly is that this work is not just based on good intentions. It's based on strong research evidence. Across many studies, we see that family involvement makes a real difference in the recovery of young folks experiencing early psychosis. And as we said earlier, psychosis is often described as a family illness, not because families cause it, but because it affects everyone around the young person. And because families are so closely involved, the way families are supported and included really matters. So, family treatment is evidence-based. We know that family education and support are considered evidence-based components of early psychosis treatment. This means that helping families learn, cope, and communicate more effectively is not an extra, it's actually part of best practice. So when families are supported and involved, we consistently see better access to care. Um, Families are often helping young people get connected to services sooner and help them stay engaged. Better treatment outcomes overall. So folks tend to just do better when families are involved. We see long-term family engagement being associated with 20 to 50% lower relapse rates compared to medication alone. And not only are there fewer hospital admissions, that's what I meant by relapse in terms of that bullet point, but shorter stays when hospitalizations are needed. Also, day-to-day functioning, relationships, and overall well-being tend to be improved. And then lastly, as I'll put there, reduce substance use, which is especially important given we know how much substance use can complicate recovery. So bottom line is, although it's not always easy, although young folks are not always willing or interested or accepting, clients have better outcomes when families are included and when they're included in care. So now we want to talk about some strategies. Being supportive of a young person experiencing psychosis, we know that it can be incredibly challenging, especially when your loved one maybe not be interested in treatment, may have limited insight, or when families are juggling just so many demands. So we recognize that many families are doing their best in complex situations, and we hope that some of what we talk about today can help empower you um, to feel more effective in your interactions with your young person. So the goal today is not to add more pressure or responsibility, but really share strategies that can help support recovery and hopefully reduce stress in the home for everyone. So there are many aspects of psychosis that are out of our control, right? Biology, genetics, and things that have already happened. But there are meaningful ways that families can influence things, particularly around stress, support, and the recovery environment. So when we think about recovery using a stress vulnerability lens, families cannot eliminate every stressor, but you can help reduce the overall load and support healthier coping. And over time, those changes can really add up and they really matter. So, some general ways in which families can support recovery include, as we already mentioned, this important role, helping access and stay engaged in treatment, right? So, all that work that many of you have probably already done, trying to problem solve barriers, helping with logistics, and just offering encouragement, even when a young person's motivation might be low to engage in treatment. Not deciding for someone, but helping them think through options about treatment decisions when they're open to it. Um, Families are so key at learning to identify early warning signs of psychosis so that changes can be addressed earlier rather than escalate to a crisis. Families are key at reducing stress and supporting healthy coping. So, including having calmer interactions, a more predictable routines at home, all of those things can lower stress. A big one, again, we don't really have control over these things, but something that we can try to encourage would be um, discouraging substance use, especially cannabis, because we know that it can worsen symptoms and increase relapse for many people. So if other folks in the family, are using cannabis and also cut back or eliminate it and continue to kind of support that for your young people is crucial. And one that I skipped over there, but is key, right? It's helpful for all of us, regardless if we're experiencing psychosis or not, is things like encouraging healthy routines, sleep, nutrition, some amount of activity can really have an impact on symptoms and recovery. It's not going to be the only thing that folks need, but those are things that we can encourage as family members and that can support the whole person. And it's really important, right? Recovery is often uneven. There are ups and downs. So it's important to notice and celebrate progress, both for you, as a family unit or an individual supporting someone, but also for your loved one. Small steps still count. And we have some printouts of these that are downloadable. We'll be sure to share with you later on. So, and I guess one thing that I also wanted to say is, although these, strategies are things that I'm encouraging families to try to implement when possible, it's really important to say that family strategies are not meant to replace therapy or medication or engagement in professional treatment, but they're designed to supplement, professional treatment. So a helpful analogy that I like to talk with families about is thinking about diabetes, right? So say you were taking care of you had a young person in your life who had diabetes. So parents don't replace medical care, but you might learn how to check blood sugars, support routines, help operate an insulin pump. So in the same way that a family could support a young person with those things, families can learn skills that can support recovery alongside treatment. All right. So building on what we just talked about, research shows that people experiencing psychosis can be especially sensitive to stress in their environment, including how interactions feel at home. So let me be clear, this isn't about blame. It's about understanding what tends to help and what can unintentionally add to stress. So in general, what we know from the research is that recovery is supported by various things, specifically warmth, structure, support, and even giving our young people space. So things like having a calm tone empathy, providing predictability, and even allowing someone to, go to their room and take space, can really help someone recover at their own pace. On the other hand, there are certain patterns that for many people can increase stress and actually make symptoms harder to manage. So there is a lot of research that shows that frequent negative comments or tense interactions, even when coming from a place of concern, can actually increase distress. Also, we know that support that feels intrusive or emotionally intense can become overwhelming at times, especially when someone's already struggling. And also, when things are complicated or fast paced, it can be harder to process information and emotions. So, none of this means that families have to be perfect or walk on eggshells. It just means that small shifts in tone, pacing, and communication can be meaningfully helpful in reducing stress. So far we've talked about why family relationships matter and how they can influence stress and recovery. And so now we want to shift to relationship-focused communication skills. And these are adapted from evidence-based approaches like cognitive behavioral therapy for psychosis, as well as motivational interviewing. And these are skills that families can use to support recovery alongside treatment. And if your individual is someone who, is not in treatment at this time or, struggling to engage in it, we think that, these strategies will still be helpful for you. So, focusing on your relationship might sound simple, but it's really the foundation of all the things that we're going to talk about. One of the most important things to name up front is that it's really hard to make progress from a place of ongoing conflict. Um, Families often have something that clinicians don't: a deep relationship, shared history, and real influence. At the same time, that history can make things more emotionally charged. So, if some of you are sitting in the audience and feeling like, oh my gosh, I'm just in conflict or I'm butting heads with my young person, that's okay. We're going to talk to you about ways to start to kind of gradually rebuild or facilitate those moments of connection. Um, right? Many families tell us we care so much, but it feels like we're stuck in the same arguments over and over. And that's incredibly common and understandable. The goal here isn't to erase that history, but it's to start shifting the dynamic, even in small ways. So, one way to think about this is using what we call befriending skills. So, it is what it sounds like. How would you act if you're trying to befriend someone, trying to make a friend? So, think warmth, positivity, just companionship. It doesn't mean ignoring problems, but it means remembering before anything else that you're in a relationship with this person, with your loved one. And again, that's the foundation for kind of everything and how to kind of move forward. So, some concrete examples of what befriending skills might look like, right? They might look like finding moments of connection that aren't about symptoms, that aren't about psychosis or treatment, right? What did you use to connect over if it feels like there's a lot of distance? Are there shared interest? Are there new shared interest? Are there family pets that you can talk about and connect over? Positive memories from childhood, if you're someone who, family trips or vacations or days out or things like that, or even just everyday moments, right? Bringing those to mind, facilitating those kind of positive emotions, bringing those back and bringing them into the relationship. These small moments really help rebuild safety and trust. Another powerful shift is identifying shared goals. So, even if you disagree about how to get to the goals, how to get there, we often want the same things as our loved ones, right? We want less time in the hospital. We want more independence. We want to help get back to school or work on important relationships, right? That's the young folks that I work with, often their number one goal is I want to get back to school. I want to get off medical leave and get back to school. I want to avoid another hospitalization. I want to get back to work or get a new job, right? So those are things that you can find that common ground and really align with. Maybe, right, it's not, I want to go to treatment or therapy once a week, but you can find things that you're both aligned on. And naming what you both want can really reduce the sense of being on opposite sides. And so, the key takeaway from this slide is that communication strategies work best when the relationship feels safe. So, everything we're about to talk about, again, builds on that foundation. That doesn't mean that if, oh my gosh, you're sitting here and you feel like my relationship is not in a good place, even if I try these, we're not making progress. It's okay. The strategies we're going to teach you are still relevant, but we just want to say when sometimes if it feels like, oh, I'm not doing any of the things yet, if you're just focusing on that connection, it's still really meaningful and impactful. Great.
So, once you have maybe built a better relationship or even a stronger relationship, we can kind of start engaging in curious questioning. And so, this is actually a key component of CBT for psychosis that trains therapists typically use for those who are experiencing or living with psychosis. All right. So, when we talk about curious questioning, we're really talking about a stance. So, we're not trying to interrogate or trying to prove a point or fix or even correct anything. So, this kind of curiosity is very genuine and compassionate and also non-judgmental. So, kind of like meeting your loved one again without assuming you already know what their experience is. And so, it is very, very common and very normal to feel hesitant about doing this because many families are understandably scared to ask questions, especially about things like voices or beliefs, because they worry that they'll make things worse. But for many people, these experiences can be very isolating. So, not being asked about them can sometimes feel like being alone with something is very frightening and terrifying. And it can be okay to ask when it's done with care and intentionality. So, here are some maybe three foundational things that you probably want to do as you engage in curious questioning. So, one is you'd want to be curious and non-judgmental. So, this is asking open questions, showing interest, avoiding assumptions. And so, the goal isn't to decide whether something is true or false, it's to really understand what your loved one is going through. We're kind of showing interest and not testing or correcting them because that can feel very invalidating. We also want to practice active listening. So, curious questioning goes hand in hand with listening, and that might mean summarizing what you heard and checking it out. So, once they tell you something, you can repeat exactly what they said and say, am I understanding that right? Am I getting that right? Ensuring that they know that you're trying to listen and understand. And so, it really helps your loved one feel heard, even if you don't agree. Asking permission can also be helpful. It actually can lower defensiveness as well. And so you can ask them, is it okay that I'm asking these questions? Or like, how are you feeling as I ask these questions? It gives your loved one a sense of control, especially during a time where for them, it may feel like things are very overwhelming and they may even feel like a lack of sense of control. I also want to recognize that it can sometimes be hard to engage in questioning if their distress is really high. And so you are allowed, and it's very encouraged to pause and take a step back. And so if emotions are escalating, it's okay to slow down, take a step back, and just like take a break. You can always come back later. And curiosity really does work best when there's enough calm to stay connected. And so asking questions and pausing when they're feeling overwhelmed also gives a message that you're willing to meet them at their own pace and no speed. You also do want to be open to multiple perspectives. And so curiosity means we're open to hearing their experiences, their explanation, without need to replace it with our own. So again, this is about understanding and not so much agreement. And so, what does this actually look like in real life, especially around something like voices? So, These are some examples that we have created that are open and respectful questions. They're obviously not some sort of checklist, and they're not questions you to ask all at once. And so we can kind of go through them quickly together. But some questions that you could ask is, what is that like for you? Can you tell me more? What do the voices say? Are they friendly, scary? Do they ever tell you to do anything? How do you make sense of where they're coming from? It's okay that I'm asking these questions. You might use one or two depending on the moment, but as we look at these questions, we notice how these questions are focusing on their experiences and not so much whether the voices are real. I also want to talk about humility because I feel like that's something that's very important. And so, it's okay to acknowledge what you do and don't know, and also letting them know that you can't hear the voices yourself, but you really do want to understand their experience. And so, saying a comment like that can really communicate respect and honesty, especially towards them, and also keep the conversation grounded. But curious questioning does help people feel understood, and that often opens the door to the next skill we'll talk about, which is validation.
Great. Thank you, Aisha. So, introducing this idea of validation, it's actually one of, I would say, the most important, powerful, and often hardest communication skills for families. Um, so, when we talk about validation, we simply mean letting someone know that their feelings make sense, even if you see the situation differently. And I really want to emphasize this. Simply being present and listening is already validating. And even, by giving attention to and doing some of that curious questioning, that is also a way to kind of be validating of someone's experience. You don't have to say the perfect thing. So let's imagine a very common, a very difficult moment. Your loved one says, I know people are following me. They're watching what I do and they're tracking me. This is usually a moment where families might feel scared and understandably want to correct, reassure, explain, or even argue. For just a moment, we're going to slow this way down and focus on validation only, not fixing, not convincing, not debating. The goal here is simply to communicate. I'm trying to understand what this feels like for you. And so now I'm going to hand it over to Aisha, who's going to talk about a few examples of what validating responses might sound like in this situation, as well as others.
So, something that I would probably say is, that sounds really scary. I could also say, I'm hearing that you feel unsafe. Hmm, that makes sense given how intense this feels for you. It sounds like being around people makes you feel really exposed and unsure of who you can trust. So, we also have some additional examples we want to provide that we heard from people we've actually worked with who are living with psychosis. So, the voices told me I shouldn't trust anyone. That sounds scary and isolating. Dad keeps telepathically communicating to me. He says I will never be good enough. That sounds incredibly painful to hear. There's phone tampering cameras in the walls. It must be exhausting to feel constantly watched. So you're really just trying to name the emotion so your loved ones can feel seen and even feel that they can trust you. Again, we're not trying to argue or prove that they are wrong or agree with their belief or hallucination, but saying that's not real or just ignore it or forget it is obviously not helpful. I also want to remind some folks that you do not have to agree with the belief to care about the feelings that they're experiencing. I also think it's important to know that not every response will be as validating as you would like, given that this is a shift from our natural tendency, from how we may typically respond, especially sometimes if you're speaking to someone who may feel that you're very close with, or if it's maybe a sibling. So things could feel different given your communication styles. I also do want to acknowledge that validating can also be very, very hard sometimes if we're not connecting um, with their thought or hallucination, or if we're even like overthinking it as well. So when in doubt, you can also just say, that sounds really scary. And also something that we've noticed kind of with these three examples, that sounds really scary, can be applied for all three examples on this slide. So it's okay and encouraged to take a moment before you respond. So you're intentional about how you engage in the validation.
Thank you so much. Right. And just really to hammer home, validation is about communicating understanding, not agreement. You are not colluding or enabling your young person by engaging in validation, right? You're helping them feel understood. And when people feel understood, conversations are more likely to stay calm, connected, and open. And that's exactly what we're trying to build towards. So, another kind of concept that we want to introduce, and a reason that validation matters so much, is that it helps us slow down our natural urge to fix things, right? This urge is very human, especially when someone we love is suffering. In motivational interviewing, there's a name for this instinct. It's called the righting reflex. So, as I mentioned, this righting reflex is the impulse to fix or reassure or solve a problem quickly. And again, it comes from a place of caring, and it often happens automatically. Most parents and caregivers often have a very strong righting reflex, and it's because you're trying to protect your child or loved one and reduce their pain. Right? So we know that the intentions are good. I do this in my own life and have to catch myself. And so let's briefly talk about when we might run into instances when this righting reflex can be unhelpful. So even when solutions seem so obvious to you, jumping in too quickly can sometimes backfire, right? It can feel invalidating. You might have like skipped over what Aisha was just talking about, reflecting back how someone's feeling makes sense, and you're kind of skipping ahead to the solution. So it's like we're not really hearing what the other person is experiencing. It can actually increase conflict or even lead to kind of the conversation being shut down. Brief example of the writing reflex could be, if you just stop smoking weed, all your problems would go away, right? Sometimes things might feel and seem so obvious, but there's a lot of other steps that kind of we might need to take before we can offer solutions or suggestions. Again, usually comes from a place of concern, but can often lead to defensiveness rather than the desired outcome of change. So, why does slowing down actually help? For people to receive advice or make good decisions, they usually need to feel three things first. They want to feel understood, confident, and in control. So when the writing reflex kicks in too fast, it can unintentionally take those things away. And this is relevant for any conversation that we're having, but especially young people and young people experiencing psychosis. There's already parts of them, right, where they're maybe doubting or questioning or not sure they can trust their reality. So really helping someone again feel understood, confident, and in control can be key. So what helps instead of the writing reflex? It's not that we're never giving advice or offering solutions or perspective, but it's slowing down the process. So first, we want to listen and validate. Then, and maybe not all in the same conversation, right? This might happen over a series of conversations. Maybe we're talking to our young person about their substance use, and the first several conversations might just be listening. But after doing that, then if you do have ideas or concerns, try asking permission. Okay, yeah, I hear you. That makes sense. Would it be okay if I shared a thought? Or can I tell you something that I'm worried about? Right? That's helping with that sense of control. Asking permission helps your loved one feel respected and in control, which actually can help them feel more open to hearing you. Um, I want to mention also that to kind of normalize, being transparent and authentic in this. It's okay to be transparent. We're teaching you some potentially new communication skills here. And if you're worried that your child or young person is going to think, oh my gosh, mom, you're sounding kind of weird or you're acting differently. Why are you talking like this? Or don't therapists speak me? Or, like we've heard it all. You can name it. You can say, yeah, this is a little different than how maybe I usually talk. I'm actually trying to work on being a better listener. And you can even laugh at it together. It might sound a little funky, or I'm trying out some new skills because I want us to communicate better and fight less. So I want to try to do what I can to help our relationship or to change things on my end. So if it feels awkward or weird, name it. Again, that kind of honesty or humility, as Aisha talked about in terms of the validation, it can really help build trust rather than taking it away. So the goal isn't to suppress the writing reflex, it's to notice it. When you catch that urge to fix, that's often your clue to slow down, validate, and try to stay connected. We'll spend some more time in future sessions practicing what to do after validation. Today's really about laying the groundwork. So as we conclude with some of the skills that we're talking about, we really want to emphasize, remember to be kind to yourself. Everything we talked about today is meant to empower, not blame. No one responds perfectly all the time, especially in situations that are scary, emotional, overwhelming. And these are skills, not instincts, right? So skills take practice. It's also really important to acknowledge that for many families, this may represent a real shift from how you were raised, how emotions were handled in your family, or what caring for a loved one looks like in your culture or community. And so we want to recognize that. There is strong research showing that these approaches can support recovery, but the goal is progress, not perfection. So as you're learning, we encourage you to be kind to yourself, just as you would try to extend that compassion to your loved one as they're learning a new thing or working on their recovery. So before we move on, we just want to highlight a few key takeaways from today. First is that families are important, can have a very powerful impact on recovery, not by having all the answers, but through how you show up in your relationship. We emphasized focusing on connection, listening with curiosity, validating experiences, and slowing down the urge to fix can make a real difference. And again, this is the foundation for everything that we'll continue building, including more specific communication strategies and ways to support yourselves as caregivers.